Symptoms of hip wear and how to prevent it. Women tend to suffer most from the painful reality that is joint wear, osteoarthritis and other muscle conditions that affect our quality of life. Hip wear is one of the most common and dangerous joint disorders out there, so it's definitely worth taking a moment to learn about the symptoms. Check it out. What causes hip wear? Hip osteoarthritis or coxofemoral osteoarthritis affect the cartilage. Remember that the hip joint is also made up of the head of the femur and the hip cup, a joint cavity where the femur fits perfectly into place. Around this area is a network of muscle fibers and ligaments that unite the cartilage, absorbing shock. You should know that hip wear can happen in one of two ways. Primary, the result of wear over time. Appears around age 60 to 65. Secondary osteoarthritis, the result of localized problems and joint problems due to dislocation or even poor nutrition and bone problems. In these cases, people can start to experience hip problems as early as 30 to 35 years old. And let's take a look at the causes of this painful condition. Trauma, dislocations, injuries or improperly cured diseases can cause you to experience hip wear. Vascular insufficiency is a disease that you should keep in mind. It tends to occur because of problems caused by osteoarthritis or dislocations, but, in this case, the cause is vascular. Congenital factors. Children often come into the world with congenital problems, such as hip dysplasia, growth conditions or other problems. Unbalanced skeletal structure. It is quite common for people to suffer from a condition in which their legs are different lengths. Symptoms of hip wear. Obviously, the first symptom of any arthritic problem is pain. But many people think that this pain should only be concentrated near the hip, when, in reality, it tends to occur in the groin region. It may even shoot down toward the lower part of the thigh, reaching the knee and reflecting back to the buttocks. Sometimes, when you move, you will feel a sudden cracking sensation. If your hip hurts, it may be a muscular problem. But if your groin area starts to hurt, this is a direct result of hip wear. In the beginning, this pain will not be very intense, and will appear mainly after you've been physically active. After a long walk, for example, or after going for a run or lifting heavy objects. Once you rest, the pain will go away. Later on, as the wear advances, that pain will become more intense and it will be hard for you to do basic activities, such as going up a set of stairs. When you cross your legs, you will feel a painful cracking, as well as at night when you toss and turn in bed. You will feel a burning sensation in your groin area. How can I prevent hip wear? You should know that if you suffer from hip pain, you should start taking steps to accommodate your lifestyle to deal with this affliction because, as of now, there is no cure. You should try to eat well so that your body will have all of the nutrients it needs. Do light exercise so that you can stay mobile without wearing yourself out. Follow your doctor's instructions without abusing anti-inflammatory medications and muscle relaxers, because they can have a negative impact on your liver in the long run. On the other hand, if your aim is to prevent hip wear and you do not currently suffer from this problem or your symptoms are very light, you should follow these recommendations. Always keep a balanced weight. Do a bit of light exercise every day, especially exercises that do not require you to move your hips, such as walking, running or swimming. Increase your consumption of vitamin C and D, because these nutrients will help you synthesize collagen. So, you should definitely try to eat more citrus fruits, mango, pineapple, carrots, melons and strawberries, as well as vegetables such as cruciferous veggies, artichokes, and garlic, which is especially good at reducing joint swelling. Gelatin is great for restoring cartilage, because, as you know, bones cannot grow back, but cartilage can. Don't hesitate to take magnesium supplements. This nutrient is fundamental to maintaining good joint health and is great for your overall health. Ask your local natural food store or your doctor where you can get these supplements. Drink at least 2 liters of water per day. It is crucial that you stay hydrated, because that will also keep your joints hydrated, thus nourishing your cartilage. You should definitely keep the point in mind. Some people also use vitamin supplements such as glucosamine sulfate, which is great for hip wear. It's a natural way to strengthen this part of your body, as well as your bones and cartilage in general. You can talk to your doctor about its benefits.